Imagine being trapped in a system where life and death hinge not just on medicine, but on money. A system where a single trip to the emergency room can cost as much as a luxury vacation. Where a life-saving prescription might be priced higher than a month's rent. This isn't a dystopian novel. It's the reality of the United States healthcare system. A system that is the most expensive in the world, yet one of the most inaccessible for millions of its own citizens. But why? How did healthcare in the world's richest nation become a financial nightmare for its people? Why do Americans pay more for medicine, doctor visits, and hospital stays than citizens of any other developed country? Today, we uncover the hidden truth behind the U.S. healthcare system, a multi-trillion-dollar industry built on profit, not care. It's called the land of opportunity, where anyone can make it big. But when it comes to healthcare, millions are left behind. The United States is one of the only developed countries without a universal healthcare system. Instead, it relies on a patchwork of private insurance companies, government programs, and out-of-pocket expenses. The result? A system where the ability to receive proper medical care is tied to employment, wealth, or sheer luck. Insurance companies, the supposed gatekeepers of healthcare, are not in the business of health. They are in the business of profit. Premiums, co-pays, deductibles, these are all designed to maximize revenue, often at the expense of the patient. For those without employer-sponsored insurance, the cost of an individual policy can be crippling. And even those with coverage often find their claims denied or their medical bills astronomically high. The concept of network providers and out-of-network charges is another cruel twist in this system. Even insured patients can be hit with unexpected sky-high bills if they unknowingly receive care from a provider outside their insurer's approved list. A single emergency room visit can lead to thousands of dollars in surprise charges, simply because the attending physician was out of network. It's a game of financial Russian roulette played with people's lives. The next piece of this puzzle: Big Pharma, the pharmaceutical industry, one of the most powerful and lucrative industries in the world. Americans pay more for prescription drugs than any other nation. In some cases, the same medications cost 10 times more in the US than in Canada or Europe. Why? Because in the United States, pharmaceutical companies set their own prices with little to no regulation. Drug manufacturers argue that high prices are necessary to fund research and development. But let's look at the numbers. In 2022 alone, the top 5 pharmaceutical companies made over $100 billion in profits. Much of their spending isn't on research. It's on marketing, lobbying, and executive bonuses. Meanwhile, people die because they can't afford insulin, cancer treatments, or heart medications. In the world's most advanced medical industry, patients are left to crowdfund their own survival. It's no coincidence that pharmaceutical companies spend more on lobbying than any other industry in the United States. They have a direct influence on lawmakers, ensuring that drug price regulations remain weak or non-existent. The result? An endless cycle where the sick pay the price. Literally. Hospitals should be places of healing, but in the US, they are also centers of financial devastation. A simple ambulance ride can cost thousands of dollars. A hospital stay? Tens of thousands. If you need surgery, you could be looking at hundreds of thousands in bills, even with insurance. And here's the most disturbing part. These prices are not fixed. 2 people receiving the same treatment at the same hospital can be charged wildly different amounts depending on their insurance status. Hospitals negotiate prices with insurance companies, meaning that uninsured patients, the most vulnerable, often face the highest bills. Then there's medical billing errors, a polite term for hidden fees, duplicate charges, and outright fraud. Studies suggest that up to 80% of hospital bills contain errors, yet it's the patient's responsibility to catch and dispute them. For many, the result is medical debt, debt that follows them for years, forcing them into bankruptcy, homelessness, or worse. In the United States, medical debt is the leading cause of bankruptcy. Every year, thousands of families lose their homes, their savings, and their futures. Not because of reckless spending, but because someone got sick. Consider this. An estimated 100 million Americans, nearly one-third of the country, are burdened by medical debt. Some avoid going to the doctor altogether, fearing the cost of a visit. Others ration medications, skipping doses to make their prescriptions last longer. This isn't a flaw in the system, it is the system. A system where profits come first and patients come second. And for the most marginalized, low-income communities, minorities, the elderly, the situation is even worse. They are more likely to be uninsured, more likely to be denied care, and more likely to suffer the worst consequences of this broken system. In the world's richest country, access to health care has become a privilege, not a right. While Americans struggle under the weight of medical costs, other developed nations have figured it out. Countries like Canada, Germany, and the UK provide universal health care, ensuring that no citizen goes bankrupt because they needed medical treatment. These systems aren't perfect, but they operate on a fundamental principle: that health care should be a human right, not a commodity. In the UK, the National Health Service, NHS, provides free health care at the point of use. In Germany, a hybrid public-private system ensures that everyone has access to affordable care. And in Canada, citizens don't have to worry about medical debt because health care is covered through taxation. So why can't the US follow suit? The answer lies in one word: money. The US healthcare system is a $4.5 trillion industry. Powerful interests, insurance companies, pharmaceutical giants, and hospital corporations have no incentive to change. The current system makes them rich, even as it bankrupts ordinary Americans. Despite the grim reality, hope remains. Activists, politicians, and citizens are pushing for reforms, whether it's lowering prescription drug prices, expanding public health care options, or moving toward a single-payer system. The fight won't be easy, but history has shown that change is possible when the people demand it. The question is, will America continue to be a nation where healthcare is a privilege? Or will it finally recognize that no one should have to choose between their health and their financial survival? This is the hidden side of the US healthcare system. And now, you know the truth.